Your doctor looks at your blood pressure reading, smiles and says 120/80, perfect, you're doing great, and you leave that appointment feeling relieved. I need you to hear this clearly. For some people over 65, that number is not a green light. It may actually be a warning sign that is being missed because the standard being used to evaluate it was not designed with your age in mind. This is not about scaring you. This is about making sure you are asking the right questions at your next appointment, because the difference between the right blood pressure target and the wrong one at your age can be the difference between protecting your brain and losing it quietly over the next 5 years. Stay with me. Here is what most people do not know. Blood pressure guidelines have been debated and revised significantly over the last decade. And at the center of that debate is a question that directly affects every person over 65 watching this video. What is actually the right target for an aging body? Here is the problem with a one-size-fits-all number. As we age, our arteries naturally stiffen. The heart has to work harder to push blood through vessels that are less flexible than they were at 40. This means that in many adults over 65, a slightly higher systolic number, that top number, is not a malfunction. It is the body compensating for normal vascular aging. When medication aggressively pushes that number down to a younger adult's target, the consequences can be serious. Blood flow to the brain drops. The kidneys, which in older adults depend on adequate pressure to filter properly, are compromised. And the risk of dangerous falls from sudden drops in blood pressure, called orthostatic hypotension, increases dramatically. This is not a fringe theory. This is an active, evidence-backed clinical conversation happening at the highest levels of cardiology and geriatric medicine right now. In this video, I am going to break down exactly what the research says about blood pressure targets specifically for adults over 65. I will tell you what questions to ask your doctor, what numbers to actually be concerned about, and what the most recent guidelines say versus what is still being practiced in many clinics. And I want to flag something before we get into it. Number one on today's list is a medication side effect pattern that affects a significant percentage of older adults on blood pressure drugs, and almost nobody talks about it at the appointment. Let's get into it. Quick, drop your age and your current blood pressure medication in the comments if you're comfortable. You'd be surprised how many people in this community are navigating the exact same situation. Okay, let's go. Here is point number 3. The 120/80 target was built on younger adult data. The 120/80 target that most doctors still use as their benchmark comes largely from study conducted on middle-aged adults. The landmark SPRINT trial, which influenced current American Heart Association guidelines, showed that aggressive blood pressure lowering reduced cardiovascular events. But here is what gets left out of the conversation in most exam rooms. The SPRINT trial excluded adults with diabetes, prior stroke, and significant kidney disease. It also raised serious concerns about overtreating older, frail adults because the participants who showed the most harm from aggressive lowering were those over 75 with multiple conditions. A separate analysis published in the Journal of the American Geriatric Society found that in adults over 65 with moderate frailty, pushing systolic blood pressure below 130 was associated with a significantly higher risk of serious falls, acute kidney injury, and hospitalizations, not fewer cardiovascular events. Your doctor may be celebrating 120/80 because the guideline says to The guideline was not written with your specific age, your specific frailty level, or your specific kidney function in mind. Patient story: Frances, 71, a retired librarian from Vermont, was put on an aggressive blood pressure regimen after her reading came in at 148/88. Her doctor titrated her medication until she hit 118/76. Her doctor was pleased. Frances was not. She was dizzy every morning, had fallen twice getting out of bed, and told her daughter she felt like she was moving through fog all day. A geriatric specialist reviewed her case and raised her target to 135/80. The dizziness resolved within 2 weeks. She has not fallen since. Your action step: at your next appointment, ask your doctor directly, Given my age and my other conditions, what is my personalized blood pressure target, not just the standard guideline number? That one question changes the conversation. Point number 2. Blood pressure readings at the clinic are often wrong. This one is straightforward and fixable, but it is causing real harm. White coat hypertension is a well-documented phenomenon where blood pressure readings taken in a clinical setting are significantly higher than the patient's true baseline, driven by anxiety, rushing, not sitting quietly beforehand, or simply the stress of a medical appointment. Studies suggest it affects between 15 and 30% of patients. The reverse problem, masked hypertension, is less discussed but equally serious. This is where a patient reads normal in the clinic but has consistently elevated pressure at home, particularly in the morning hours. Research published in the European Heart Journal found that masked hypertension carries cardiovascular risk equivalent to sustained high blood pressure, and because it looks fine at the appointment, it goes completely untreated. A single clinic reading taken once in a rushed appointment is not a reliable basis for a major medication decision. Yet for millions of seniors, that is exactly how their blood pressure management is being handled. Patient story, Gordon, 74, a retired police officer from Ohio, had clinic readings that were consistently around 125/78. His doctor was satisfied. His wife bought him a home monitor after he mentioned occasional morning headaches. His average home reading over 2 weeks taken at the same time each morning following proper protocol was 158/94. His doctor presented with the log, immediately adjusted his treatment plan. Gordon had been walking around with unmanaged hypertension for years while his clinic numbers looked fine. Your action step. Buy a validated home blood pressure monitor. They cost between $30 and $60. Take readings at the same time every morning after 5 minutes of sitting quietly. Log them for 2 weeks and bring that log to your next appointment. That log is more valuable than any single clinic reading. If this is useful, subscribe. I cover exactly this kind of information every week. The things that fall between the cracks of a 10-minute appointment, hit the bell so you don't miss the next one. Okay, Number one, your blood pressure medication may be quietly lowering your blood pressure too much and starving your brain. This is the one I flagged at the top. When blood pressure is pushed too low in adults over 65 and too low for an older brain is a different threshold than for a 45-year-old, cerebral perfusion drops. That is the clinical term for blood flow to the brain, and an aging brain that is not receiving adequate blood flow does not announce it loudly, it whispers. Slower recall, mild confusion, fatigue that feels like aging, word finding difficulty, mood changes. Sound familiar? For many seniors on blood pressure medication, these symptoms are being attributed to getting older when they may in fact be a direct, reversible consequence of over-medication. A study published in JAMA Internal Medicine found that older adults with intensive blood pressure lowering, systolic below 120, showed significantly greater brain white matter lesion volume over time compared to those with moderate control. White matter lesions are the structural markers of reduced blood flow to the brain. They are associated with cognitive decline, dementia risk, and loss of executive function. A separate study from neurology found that in adults over 70, low diastolic blood pressure, that number below 60 millimeters of mercury, was associated with a near doubling of dementia risk compared to those with diastolic pressure in the 70 to 90 range. Your bottom number matters. And if your doctor is only focused on bringing the top number down without monitoring what is happening to the bottom and to your brain, that is a conversation worth having. Patient story, Miriam, 68, a retired pharmacist from Arizona, and yes, a pharmacist, someone who understood medication, had been on 3 blood pressure drugs for 4 years. Her readings were consistently around 112/58. Her cardiologist was satisfied. Miriam was not. She had become increasingly forgetful, was struggling to follow complex conversations, and had started writing everything down because she could not trust her memory. She requested a geriatric cardiology consult. The specialist looked at her medication list, her readings, and her symptoms and said, "Your brain is not getting enough pressure." One medication was tapered. Her readings settled around 132/72. Within 3 months, Miriam told her daughter, "I feel like I got my mind back." Your action step, two things. First, at your next appointment, ask your doctor to check your diastolic number specifically. If it is consistently below 65, ask whether your current medication regimen needs to be reviewed. Second, if you are experiencing cognitive symptoms, brain fog, memory slips, confusion, fatigue, and you are on blood pressure medication, do not assume it is just aging. Ask your doctor directly, could my blood pressure medication be contributing to these symptoms? You deserve a real answer to that question. You now know what most people sitting in that exam room don't, that the number your doctor celebrates may need context, that a single clinic reading is not the full picture, and that for the aging brain, blood pressure that is too low can be just as dangerous as blood pressure that is too high. You are not being asked to distrust your doctor. You are being asked to be a more informed participant in your own care. Ask the questions, bring the home log, request the personalized target. Save this video. Share it with someone you know who is over 65 and managing blood pressure, because they are almost certainly not hearing this at their appointments. Next week, we are talking about cholesterol, specifically the cholesterol number your doctor watches closely and the one they almost never check. That is a far more accurate predictor of heart disease and stroke in adults over 65. One number, hiding in plain sight on your blood work. Most seniors have never been told to look at it. Subscribe and turn on the bell. I'll see you next week. I'm Dr. Grace Chen. Stay informed. Stay well.